This is Dr. Jon Rhodes, doctor physical therapist in Farmington, Utah, and he's another TPI medical provider up there. I'm going to let him introduce himself here, and so here you go.
Okay. Yeah, thanks for having me on. Yeah, I've been working with golfers for about 21 years. I was one of the first that worked on PGA Tour. I worked with Health South's crew, where we worked with the LPGA gals and the PGA Tour back in the late 90s, early 2000s. And then TPI came along early 2000s and started kind of rewriting the book on how to work with rotational athletes and making them stronger and faster, and kind of learned right along with the best of them. And for those last 20 years, we've been really seeing some amazing things happen, right? The guys are hitting it further, hitting it more flexible, and hitting it farther, and speed wins. And so we've tried to evolve over the years to try to have a program to help everybody hit it farther, because that's what everybody wants to do is hit it like Bryson now. So kind of been lucky to be involved with this a long time. I've got a practice in Farmington. We've got 3 clinics now, but I'm mainly in Farmington, where we have a little golf room. I'll even just show you my golf space. So turn it backwards here. So we've got a spot here where we can hit balls. Got a little cage type thing, and so we can not only help people get feeling better physically over in the clinic, but we can actually hit golf balls in here so that they can help their game be better as well. So kind of a fun little place.
That's cool. It's a good little space you have for a little office that you have, and you can work from there with swings and everything. So yeah, TPA has done a lot with working on the body, and when I've gone through it, it helps with the body and helping improve their body more than just the swing, but going a lot further than that. So they've done a lot with that. You have a K-vest. So tell us more about the K-vest. What is the K-vest, and how does that help your golfers?
Yeah, so as we work with golfers, both you and I measure the body, right? We see what's working, what's not working. And somebody will come in with pain, and maybe it's an elbow pain, maybe it's a back pain, and we'll find where it hurts and why. But I always like to see if their swing is causing that, or maybe it's their work that's causing that. Even though it's showing up in the back, maybe it's not even coming from the back, right? It could be something else that's breaking down. So the K-vest helps us see efficiency, to see what's moving first, second, third, and fourth in the golf swing. And based on what's breaking down, then we can really focus in on how to fix it, and how to fix it more effectively, because now we're actually seeing it. Our job as the medical side, we're not really trying to make their swing look different. But if it's not efficient, then we want to change it or make their body move better. So, you look at a guy like maybe a Matthew Wolf, who's got the funny move, and it used to be Jim Furyk when I was out there. But we would never change it, because his efficiency, both of those guys, their efficiency is really good. And so unless we know and can measure efficiency, we might try to change somebody that we shouldn't have changed in the first place. So the K-vest just focuses me in on where the problem is. And we can even do a couple examples if you want to, and show you some of the swings in motion or something. But it really is a focus tool.
Yeah, do you have one you could show us really quick?
Yeah, let's see if we can pull one up here. In fact, I might even put it on, and we can even show a couple examples of some swings. Maybe we do that. Okay. That might be more fun. What do you think?
Yeah, that'd be more fun for everybody.
Yeah. Try to get this set up where you can see me swing. How's that look?
Looks good.
There. Okay. This has a chest sensor. You just wear it like a backpack. So it just goes right on the back, like that. Try to move this a little more.
Okay.
Then I have a hip sensor. It goes around like a belt, like so. And then a left arm sensor. so. See that at all? And then we
Slightly,
use a glove
yeah.
sensor. Yeah, we use a glove sensor. I'm wearing black. It probably wasn't the best idea to wear black.
It's a little camouflaged.
Yep. The good part is it's really light so that you don't really see it, or you don't really feel it as you swing. It's all designed to make you just swing like a normal swing, which is great. Okay. I normally do this for the patient, so it's usually quicker. Okay, getting closer. I'll find another spot here. Maybe. Okay, sorry, I snuck away. I had to just calibrate the system real fast.
Okay.
If I take the computer here, and let me see if I can spin this the other way. Switch camera. Okay, so now I'm wearing this vest. So as I make some moves, you can see on the screen. I'm trying not to make the screen move, so I can see. You can see how I'm moving.
Yep.
Okay, and the screen is moving. It's reading for us my movements. So put that down so I'm not moving with it. Wow. Jared, you've seen this before, haven't you?
I have seen this before, yes.
Yeah, yeah. So it's this attempt. If it's not working, we can delete and start over. But anyway,
That's fine.
Okay,
You can edit.
here we go. Well, so one of the things. So my swing is so perfect. You don't want to see my perfect swing all the time. So what if I do a couple bad swings? And one of the things we see a lot is an over the top. Right?
Yeah,
So
show us one of
line
the
here.
most common stuff you see.
Yeah, so we'll see them kind of coming over the top. So let me do a swing like that, and then we can kind of see what the K-vest shows us, and then we can I'll show you what I'm looking for on the K-vest. So again, don't do what I'm doing, which is don't warm up before you hit. Normally you do some stretching, but coming right out of the clinic, I'll just hit a little over the topper here. Good. And so sometimes even with our eyes, we'll look at that and think, hey, that wasn't too bad, right? And so then if we go and just take a look at what the computer told us, and we look at it in a performance graph setting here. So if I zoom in right in through here, what I'm really looking for,
Oh, there you go.
okay, you can kind of see there's a bunch of squiggly lines, right?
Yeah.
And the idea here is for nerds like me to kind of read what squiggly line is doing what. So if I even just take a quick example graph, you can kind of get a sense for what it should look like quickly here. Look at the red line, see how it's leading the downswing there. So it's a graph that's going upwards first. So it goes red, green, blue, and tan. How's that coming through?
It's coming through well. And just for others to see, the red would be your pelvis.
Good. You can kind of see as I zoom in there, red's hips, yep, chest or torso, blue's left arm, and the club. And you want that club to sit really low and be the last thing to cross this from a negative, which is backswing, to positive up to downswing. So if the hips are leading nice, there's good spacing here, and I look for a 1, 2, 3, 4 transition right there. And if we go to that swing we just did, we're kind of seeing a whole bunch of jumblies. We see kind of blue going real fast. The club's a little bit late, but there's a little jog where it goes boop up and then really takes off. So we're seeing, we can kind of see quickly that the body was a little bit out of sync in that swing. And so we're able to then stop and go, okay, well, why is that the case? So we can look at it in two different ways, that graph ways or in a cartoon version, which is kind of fun. Like we just put me on EA Sports or something here, and we can watch the swing. In fact, there's a really good kind of a move there that you can kind of see that maybe we didn't see in fast motion is right there. And Jared would look at that and say, yeah, that kind of hurts his back even just looking at it.
Right.
And we just see that a whole bunch. And what would you call that, Jared?
That's the reverse spine angle, reverse pivot.
Yeah, exactly. And in that quick 2.4-second swing, we really couldn't quite see that. But right in here in this slow motion cartoon version, we can really see that.
Mm-hmm.
And if we go back to those upper body angles on the graph, I didn't quite reverse, but I got to 0, and we want to stay away from 0 on getting backward bent there. But that does it. It looks like it's too much there. If I was Jared's patient, I said my back hurt, you would be able to say, yeah, no wonder. I can see that, right? I can really tell. So if I'm backward bent, so let's go to switch my camera. We'll go back over here. And you see this a lot too, don't you? There's just a ton of this as you're here, it just gets here. So if I'm back here, I really have a hard time saying, can I drive my hips without it throwing the club kind of over the top? So I'm backward tilted, get here. Then I'm gonna have to throw my hands to maintain any balance at all. So I was over the top, but it wasn't that I didn't know what I was doing. I was trying to fire my hips first. You know, our coach said, hey, fire those hips first. But if I'm coming at it from the wrong position, then I'm never going to quite get there. So the KVS helps us see the sequence, but it also gives us that vision of, okay, now we got to work on loading back here. Now see where, if I take this backswing here, see I'm loaded and I'm tilted away versus over here. Now, from here, I can really step into it or drive those hips, and now my arms can wait and be patient for that coming through. So quickly, we can kind of see the fact that, wow, they're over the top, yes, but why? Why are they over the top, right? And then, is it an arm injury? Is it a back injury? But it's all because of what they did swing-wise. So that's kind of how we use the vest. Is for quick diagnosis, stuff like that.
Yeah, so you take that technology, that data that you gather, and then you can examine the golfer's body to see if there's any physical limitations that can lead to that, and then work on the body, then work into, again, with a good swing coach to help work with their improvements there.
Exactly. Yeah, you can and maybe they don't even have a coach, right? And that's where we can say to them, or the coach is telling them to do one thing, or they don't have a coach at all. We got to help them find somebody, because technique is critical. We don't really want to be your swing coach, but we want your body to be perfect and ready, so that when the swing coach goes to work on things, you're ready to do it for sure. Yeah, it's just more efficient, and it's individualized. I don't know that I've given the same exercise program to the same person, because every time we measure and see them, everybody has those unique differences. And if you're going to a place where they put your swing up and put Dustin Johnson up, and they go, well, look, you're not swinging like Dustin Johnson. Well, run far away, because nobody swings like Dustin Johnson. Unless you're physically just like him, you're not going to. Okay.
Right.
You've got to swing your swing, and we're going to help you find what your swing is.
I think it's why it's so important to get the tailored assessment of your specific swing, your body, and get a tailored treatment plan for you, whether you're injured or just what you want to do with performance-wise. So
exactly.
And
different. Right now is the best time to work on that. Most of my players, I tell them to do some things, take some time off and stretch, and work on these skill generator exercises. So in fact, real quick, 2 ways to attack these deficiencies. One is stretching and strengthening, right? We got to stretch the body, get it ready. The other is we have to develop a pattern, a new motor pattern, to make that come out. Under pressure, we'll just kind of do what we've always done. So to get those to change, we have to take a step back and do these motor learning drills. So I tell my players all the time, let's take a couple weeks off of playing, still hit balls, but let's work on these drills that we've given you. And what do they all do? They keep playing, right?
Yeah.
It's sunny day. I got an hour. I'm not going to go do my stretches. I'm going to go play or hit some golf balls. So now's a perfect time. to really take care of your body, let it rest through the winter, and then, get with Jared, get measured up, get a specific program to you that's going to help attack those problems that just kind of nag over the year and usually show up October to November. They're really not great right now. So put them on the shelf, get some swing drills, get some motor learning drills, and then in the spring, you come out and you're really, really good and ready to go, and you'll be ahead of the game for sure.
Yeah, I think Utah is a very unique situation compared to a lot of the southern places where you can play golf. Is that in the winter you're kind of forced to put the clubs away because it gets so snowy. You get snowed in, and if you can use that time like a real off season to really take care of your body, then the next year can be so much better and in that way. So
yeah, and then you'll have those players that are like, well, I'm going to St. George or something.
Right,
so
St. George's.
you almost have to. I enjoy the off season because it does allow some rest. It's that go 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 go. If your swing is perfect, go 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 go. That's fine, right? It's the problem is if we have a little issue, like if the swing I just showed you with my back bending, I didn't feel any pain right now, but if I did that 1,000 times, if I do that 2,000 times, that's the breakdown that we unfortunately have to see in the clinic. And we don't mind seeing you. We're happy to see you in the clinic,
right.
But we know you'd rather be golfing. And so it's those little things that you just want to get out of the system right now. And then you can play and play and play and play. And how we do this, and Jared does this well, is you have to start with a nice stable base, right? Everybody wants speed. Everybody wants to hit it farther. Everybody wants to crank them out there, right? And I hit them 360, so everybody wants to be me. No, I'm just kidding.
Right.
But the key isn't just go to do speed work. You've got to start with a real stable foundation. And usually the first program I give, which takes about 6 weeks to do, is a lot of stretching, a lot of core foundation work that is non-rotational. Then once we've built a nice stable base through those 6 weeks, you come back, we remeasure, and then we start adding on the speed work. So be patient with speed. Speed work creates injury. And again, we don't mind treating you, but again, you don't want to be in here. You want to be out playing. So start with the basics. Get a nice stable base, first floor, we call it, first floor work. Then we can add the second floor and the third floor, which is strength and speed. So be patient with the program. And a lot of my clients will say, man, you sent me the program and that seems so easy, right? But do them. You make sure they're easy. And then in 6 weeks, come back and tell us they're easy still. And then we'll measure you and make sure you're ready for speed work.
Yeah, just building the foundation. I think a lot of things that the pro golfers have is that they have a really good foundation so they can build upon that. And then when an amateur wants to be like that, they don't quite have that foundation to build on it, and then they have more injuries later on. So
correct.
As far as injuries go, what kind of injuries do you see come in with the amateur golfer compared to the pro golfer that you've seen?
Yeah. The back is probably number one, right? The ability to control your posture. So the golf swing inherently there's a lot going on, right? So you're trying to rotate, you're trying to generate speed, and the amateur golfer has a hard time holding their posture just right. And as a result, what breaks down usually is the back. The back's the first thing to break down. Then we'll start to see elbow issues, and from now their hands are having to save it on the way down, and then probably lastly we'll see shoulder stuff. Versus that exact opposite with pro golfers. Their backs don't always hurt, but their elbows and shoulders start to hurt more because they're doing so much more practice than the average everyday guy, right? They're spending 3 to 10 hours a day practicing, and that's going to just create some of the overuse stuff that we
overuse injuries,
in the arms and stuff. Usually not swing related, but just from just doing too much, right, over and over again, and preparing for the next tournament, and they're just hitting ball after ball or playing a lot more. So the average guy though, who kind of does what I did, you show up right before your tee time, and a couple of little toe touches, a couple of little swings, and then off you go. And that's where the body will start to break down quicker, because it's just not, rotation is not something we do all the time, especially if you're a computer job, everything's straight in front of you. Now all of a sudden you're asking your body to rotate real fast in a circle, and the injuries will show up. So yeah. And then the good part is medicine's getting better and better. And so our golfers are playing into their 70s and their 80s, and we're dealing with new knees and new hips. And these are people that really want to keep playing the game, which we want them to. And they're just dealing with a brand new joint, or a joint that probably needs to be replaced and they haven't given in yet. And so we see a lot of amateurs just hanging on as long as they can before the joint replacement. But no, you can play after, for sure, if we do it right, the rehab.
Do it right, yeah. As far as recommendation goes for the amateur golfer who works at a desk and golfs maybe once, twice a week, what recommendations do you usually give your clients that want to prevent injuries, and any general recommendations for them?
Yeah, and there's a lot of general stuff that people can do that are great, and but also you can also give you some stuff that maybe even though you sit all day, you're actually pretty good rotationally, you're not very good at the squat movement or something. So I've really tried hard not to just blanketly give a bunch of things. Instead, I want to see exactly what that person needs and help them out. I used to work with the BYU golf team, and at the time we had Danny Summerhays was there, and another guy that was from this area up here in northern Utah is named Clay Ogden. They were both on the team together. And I talked to Coach Brockbank, and he said, give me 10 exercises we can do as a team, so that we can work out as a team and we can feel the camaraderie as a team. And I said, great, I'm happy to give you 10 exercises. Danny is 5'8", and he weighs about 185 now. Clay is 6'1" and 140 pounds, right? So tall and skinny versus more stocky and built. I said, okay, you just need to tell me who you want me to make worse, Clay or Danny. And he said, no, you don't understand. We just want to work out together. And I said, well, that's fine. You can work out together. I'm just going to make one of them worse. Okay. So he finally got the idea that I've got to come and measure each one. And Danny's program is going to be different than Clay's program. And so blanket stuff just doesn't work, because I could make you worse, and I don't want to make you worse. So I don't know.
No, that's good. I asked that to reiterate the fact that assessing everybody individually is the best way to go, because there's not one there's not one exercise that fits all, or no one program that fits all.
Yeah.
And
100%
you may want it that way, but it doesn't work.
Yeah.
So,
and if you're already working out, right, you're already spending an hour at the gym, why not spend an hour doing the things that help your game? And that's what Jared can do. That's what we can do to help you get that hour more effective and more efficient in the time that you spend there, so that you're making your game better, and not just, it's nice to be in shape. We all want to be in shape, but golf shape is different.
It is different. Great. Thanks. Thank you, Dr. Rhodes. We will talk again soon, and share this with everybody. So
sounds good. Yeah. Thanks for reaching out.